Hello and welcome back to Silvia's Health Hints for expats, tourists, abroad students from Florence in Italy. Today I want to talk about medications to take while you are traveling. I will give you a short, useful list of medications you should take with you when traveling. And it doesn't matter if you travel for professional reasons, for vacations, or if you take medicine with you for the first period when you move to another country. Why taking medicine with you? Many, not most, but many of the everyday health issues you can also resolve by yourself without going to a doctor, without going to the hospital. In this way you save a lot of money and time doing it a little bit by yourself. It can also be that you are traveling to an area where it's difficult to find a doctor. Or it can be, in some countries, it can be difficult to get all medications. What is the, I don't want to say negative side of taking medicine with you, but what is the problem? Some drugs require a pool transport, which can be difficult to be guaranteed while you are traveling. But also many other drugs who don't require that it's really cool. Normally shouldn't be exposed to temperatures which are, generously more than 25 degrees. Otherwise they get damaged when exposed to higher temperatures. This applies, for example, for drugs that contain steroids that a lot of people take for allergies or for insect bites or for eczemas. The steroid stops to work if exposed for a longer time to higher temperatures. The list is fought in first place for Italy because this is a channel for expats, for foreign people who travel or live in Italy, but it can be also used for other destinations. I will do a separate video about medications for long distance travel or exotic countries like Africa, India or tropical destinations. So this is like really the standard medication if you travel in Europe, for example, or to the United States, Australia, things like this. The following list is not complete and doesn't take into account individual health conditions. The drugs can also be replaced by other drugs, and it can also be that if you go to your doctor, he will recommend you different drugs. This doesn't mean that one is better or worse than the other option. So let us start. Paracetamol. Paracetamol is a painkiller and it is for fever. I normally recommend to take 500 milligrams instead of 1 gram, because 500 milligrams, the effect of 1 gram is not so much bigger than of 500 milligrams, but 500 milligrams you can take more often. It's fine for different types of pain, not severe pain, but like slight or middle pain, for example headache. It's very good for fever. It works better for fever than, for example, the funds like ibuprofen or aspirin or diclofenac. The positive side of paracetamol is that it doesn't irritate the stomach. And it can be taken during the whole pregnancy. The negative is that it doesn't work on stronger pain, especially on pain which is like musculoskeletal pain, when you have, for example, a muscle strain or you have a contusion or some kind of injury. Normally, paracetamol is not so effective. And now we come to the next one, ibuprofen, which I, for adults, recommend only in the dosage of 600 milligrams. This is for fever, pain and inflammations. So, for example, we take ibuprofen for bacterial or viral infections, like the common cold, sore throat, otitis, urinary tract infections, all these things. But it works also very good if you have some injury, if you had a contusion, if you have a distortion, if you have a muscle strain, all these things, back pain, things like this, it works much better than paracetamol. It's less. The negative side of ibuprofen is that it's less effective on fever. So in some cases, when the fever is very high, especially with children, sometimes ibuprofen is not sufficient. But in these cases, you can add paracetamol because these are two different drugs from two different groups, and they can be taken even together. And ibuprofen is really good. It's a really good anti-inflammatory effect. And if you take it, for example, for these common infections like UTI or a sore throat or otitis, if you take it with the first symptoms, in many cases you can avoid that you arrive to the point that then you need an antibiotic. Okay, we go. There's also something, a negative side of ibuprofen. This is that it irritates the stomach. So this is not something to take for a longer period. It's the best is to take it for 2, at least maybe 3 days. But then if the problem persists, you should really seek for help with a doctor and resolve the problem in another way. It is the first choice anti-inflammatory in pregnancy and breastfeeding, but it cannot be taken in the last trimester, in the last part of the pregnancy. Instead of ibuprofen, you can also take aspirin or diclofenac. These are drugs from the same group with more or less the same effect. Okay, then what should you take also? Antibiotics, of course, for bacterial infections, airways infections, urinary tract, but also soft tissue and skin infections. For example, if you hurt yourself or if you have an insect bite which infects. The most common or the best wide spectrum antibiotic, which covers a lot of different bacteria, when you don't know which bacterium is causing you the pathology, is amoxicillin with clavulanic acid. It's a wide spectrum antibiotic. Normally you take it twice a day for 6 days in the dosage of 825 plus 125 milligrams. In case you have a strep throat, means that you have a tonsillitis or a pharyngitis which has been tested positive for strep A, you need to take it for 10 days instead of 6. Attention, amoxicillin is from the group of penicillin, so who is allergic to penicillin, many people are, cannot take amoxicillin. When you take antibiotics, it's also important to pay attention to the exposure to sun, because you can burn a little bit easier than without. Amoxicillin is not as bad as, for example, doxycycline, where you really can get a sunburn. But anyway, you should always pay a little bit attention. If, for example, you cannot take amoxicillin because you're allergic to penicillin, you can also take azithromycin, which normally the dosage is 500 milligrams, and you take it once a day for 3 days. This is also a very positive side, but it's shorter. You take it only once. In vacation, it could be you could like it more. And it's good because it's also it works also on gastrointestinal infections, like for example the traveler's diarrhea. Then what else should you take? An antihistamine. An antihistamine, the most known are the ingredients loratadine and cetirizine, or desloratadine or levocetirizine, which make a little bit less tired. You take it with you in case of allergic reaction. It helps also against itching, and we have tablets, and we have also topic antihistamines. Then steroids, they are for allergies, itching, eczemas. We have tablets and topic creams. Steroids are also very potent anti-inflammatories, but they shouldn't be used for inflammations, because for inflammations it's much better that you take funds like ibuprofen, aspirin or diclofenac, because they have some side effects which can be potentially dangerous for some patients, like patients with diabetes. It increases the sugar, or patients with high blood pressure, it makes the blood pressure higher. And the other negative side of steroids is that you need to pay attention to not expose them to higher temperatures, because then they just stop to work. Another thing, if you take steroids for allergies, it's very important to know that they work slow. They are not suitable for an emergency. If you have a severe allergic reaction, you should first give the antihistamine, because this works fast, and then you can add, in a second place, you can add also the steroid, which has more a long-term effect. But it needs sometimes 4 to 6 hours to make really the complete effect, and this for a severe allergic reaction is too slow and then too late. What else? Probiotics. Probiotics are good bacteria and yeasts for a healthy intestinal flora. You know that the intestinal is the main place of our immune defenses, so it is good for immune defenses. It is also very good to treat or to prevent traveler's diarrhea. Giving the good bacteria to the intestinum, they are more and they can fight the bad ones easier. So if you suffer from travel diarrhea, take probiotics and drink enough, because you're losing a lot of liquids and risk to be dehydrated. If the diarrhea is very persists, it doesn't go away, even if you take the probiotics, and it's always liquid, and you really are at risk to dehydrate. You cannot drink as much as you lose. Then to stop the diarrhea, it's good to have with you carbon tablets. Now, a lot of people take also with them Imodium. Imodium is a very, very known drug against diarrhea, but you should use it only if you really need to stop or interrupt the diarrhea, if you need to board on a plane, if you need to board on a train, if you have some presentation, something like this, because Imodium is not resolving the problem. The stuff which is in your intestinal tract wants to come out, the body wants to throw it out, and once the effect of Imodium stops, anyway, the diarrhea will come back. Then there's not only diarrhea, we have also nausea and vomiting. So also nausea and drugs for against vomiting, like metoclopramide or domperidone. Here the same story like with the anti-diarrhea drugs. If in the beginning it's good to let it out, because obviously in your stomach is something that is wrong. But then if it continues, or if you are not able to drink, to replace the liquids you lost with the vomiting, because you're so nauseous, of course you need to take a nausea medication. For seasickness, which happens also in the car, on the bus when you travel, also some antihistamines works against the nausea and against the vomiting. So then you should also always take something with you, like topic medicine for injuries, infections, sunburn, insect bites. An antiseptic or antibiotic cream or ointment for skin infections, which then you choose in your country. All insect bites can cause local reactions, allergic reactions, and can also infect. This can even happen with a normal mosquito. It would be best to choose an antiseptic cream which that also can be used on open wounds, because then you have also something when you have a cut or a laceration. A cream with sulfadiazine silver is one of these creams or ointments you can use also on open wounds. You can use it it's perfect for burnings, infections. In Italy it's called Soffargane cream. In many other European countries it's called Flamazine. Other examples for anti-infective creams are fusidine or fusicord with steroid, or bepanthen or bepanthen plus. In Italy, it's very popular is an antibiotic which is called gentamicin. We have a cream with only the antibiotic, or we have a cream with gentamicin and steroid. Then an antihistamine gel or cream. The most known in many countries anyway is phenistil. It's good for burnings, insect bites, allergies, and reduce the itching. Cortisone creams for allergic reactions on the skin, for severe itching, if the antihistamine doesn't work enough. Then you should also not forget about disinfectant, sterile gauze, patches, elastic bandage, for example, to stabilize distortions before you go to the doctor. A thermometer. This is something really funny. I never had any patient who was a tourist, who took with him a thermometer, which is such a small thing you can put in any luggage. But always when I ask, did you measure the temperature? Do you know if the fever is like 38 or over 38? I don't have a thermometer. I mean, a thermometer can be bought in Italy, also in any supermarket, but really, people, this is something small, it has almost no weight, and you really can take it, you really should take it with you. Then also a protection about STDs like condoms. And before departing, you should check your vaccination if you are up to date. You should also check recommendations and requirements for vaccinations for the destination you go to in time in your home country, because it can be difficult to get them then in another country. I had patients, they came to me, they were traveling from another country and from Italy then to another country, and discovered that they need urgently some vaccination, and this is sometimes not so easy, because you don't have access to the public system, to the vaccination centers. Sometimes there's a shortage and the vaccine cannot be found. So really, these are things to check at home before you depart in time. Then, of course, you shouldn't forget about your regular medication, the medication you take always, like for example, for the thyroid, for the blood pressure, for the sugar, whatever you are taking, and your birth control. This is also something that happens very, very often, that I get a call, I arrived in Florence, I discovered I forgot my birth control, I need it urgently. So I hope you will travel a lot, you will see nice places and enjoy holidays, vacations, or have success with your professional trips without needing all these drugs. But this is a list which I think is helpful to organize before you depart. Thank you very much for watching me again, and we see each other the next week, I hope. Thank you.